In order to receive reimbursement from Medicare's care management programs, you'll need to know how to properly submit your claims to CMS, also known as the Centers for Medicare and Medicaid Services. In this video, we'll discuss the requirements to be aware of when submitting your reimbursement claims so that you can avoid common errors and start seeing a return for all of your hard work. Hi, this is Seth from ThoroughCare. We specialize in helping practices manage, bill, and streamline reimbursements for value-based care programs like chronic care management, remote patient monitoring, and behavioral health integration. First, let's talk about the 5 things you need to have in place before submitting a claim to CMS. You'll need CPT codes for each program you're managing for the patient, ICD-10 codes tied to each of those conditions you're managing within the program, date of service, place of service, and a provider name which includes their National Provider Identifier or NPI number. While it's not required, you may also want to keep track of the name of the care manager who provided the services in case of an audit. First, let's discuss CPT codes. Current procedural technology codes are 5-digit numbers assigned to each service a medical practitioner may provide to a patient, including medical, surgical, and diagnostic services. Insurers use these codes to determine the amount of financial reimbursement a practitioner gets for that service. Next are ICD-10 codes. ICD-10 codes identify medical diagnoses informing insurance companies about the care you provided and why. ICD-10 codes are used along with CPT codes and are required for every claim submission. For example, chronic care management requires 2 ICD-10 codes for each claim, as CCM requires 2 or more chronic conditions to be billable. For other CMS programs like remote patient monitoring, annual wellness visits, behavioral health integration, and transitional care management, you must attach at least 1 ICD-10 code. Then there's the date of service. While recording the date of service may seem pretty straightforward, there are some rules to keep in mind. For example, programs that are time-related like CCM, RPM, and BHI require a date of service that meets the following criteria. They can occur no earlier than the day the patient achieved their billing tier. For example, 20 or 60 minutes of care. The service date cannot occur any later than the last day of the month in which the service was provided. So the correct billing date for a patient is the day the patient receives 20 minutes for each month. In cases where additional billing tiers are available at 40, 60, 90, and an additional 30-minute increments, the date of service is the date of the time log that puts the patient at that next tier. As for the place of service, you'll want to include the designated CMS code, as there are specific codes for each location where the services were rendered. Typically, you'll be using code 11 for a provider's office. However, we'll include a link in the description below to a complete list of places of service codes. Once you have verified that all requirements have been met, you can submit these claims to CMS for billing. The issue providers seem to struggle with the most when submitting claims for reimbursement is assigning proper CPT codes and ICD-10 codes. While your EHR can be helpful in some ways, many practices find them to be clunky, unintuitive, and prone to errors when assigning codes. That's why we recommend using care coordination software. Good care coordination software will typically assign the proper CPT codes depending on the type of treatment provided and the amount of time logged. For ICD-10 codes, look for software that includes easily searchable lists that are tailored to the CMS programs you're offering. Along with simplifying the billing process, care coordination software streamlines the creation of patient care plans, supports staff workflows, and keeps important details from being overlooked. This leaves more time to focus on providing optimal care for your patients. As you can see, there are a number of important factors to keep in mind when submitting claims for reimbursement. If you're interested in how ThoroughCare can help you set up and manage your own care coordination program, please reach out to us. We're here to help. So there you have it, and don't forget to click like and subscribe to our channel to learn more about the many value-based care programs that we offer. Thanks for watching.